is an awful multiplication of cells out of the normal that take over your system rather than the normal cells. That's what it is.
According to the Ministry of Health, in 2010, 3,198 persons died of cancer, accounting for 24% of all deaths in Jamaica. The common types found in women are cancers of the breast, cervix, and colon. On the other hand, cancer of the prostate, lung, and stomach are more common in men. The good news is doctors say that these illnesses are largely avoidable. And the doctors say prevention and early detection are our best defenses, even while the level of treatment and care is improving. In addition to promoting healthier lifestyle, government and its private sector partners are revolutionizing the gamut of care, with 2 linear accelerator machines purchased to provide timely and efficient access to cancer care treatment. Our most vulnerable patients are targeted to have access at no cost at centers of excellence being established at the St. Joseph's Hospital and the Cornwall Regional Hospital.
Changes in standard of living, introduction of screening methods, and public health education and promotion have impacted the distribution of cancer seen in Jamaica over the years. This trend is expected to continue, at least in the short term, as public health education increases and screening becomes more widespread.
In the case of cervical cancer, caused by a viral infection from the human papilloma virus HPV, the pap smear is considered the best screening method to date.
And the reason for this is that a screening method should be able to find a disease before it has become established, find it in the precancerous phase, be easily accessible, not very invasive, inexpensive, and universally available. The pap smear satisfies all of that sort of criteria.
The pap smear is not an actual test for cancer, but rather a test to detect the presence of any abnormal cells with the potential to develop into cancer. The result from this painless process is used to inform decisions about what treatment to apply to prevent cancer from developing.
A sample of cell is taken, sometimes even with a little brush, so there's no scraping and clipping on all of that like what the perception is out in the street.
Squamous cells, which are cells lining outer layers in areas such as the lung, hand middle, mouth, vagina, and cervix, are usually affected by the human papilloma virus. The virus gets to the cervix during intercourse and has the ability to transform the normal cells into precancerous ones.
You hardly ever get cervical cancer in women who have never had sex. From getting the virus to getting cervical cancer can take 15 years or more.
The recommendation is for annual screening to detect, monitor, and treat with any incidents or progression that might be taking place.
The next reason for annual checks is that there is no test that is 100%. All tests have false positive and false negative. You could do a smear and it is normal, but something is there. But if you keep doing it, it will pick up something.
Abnormal smears can be treated in the precancerous stage by methods that include freezing, cauterization using electricity, and what is called the loop. That is, removing the bad area and having what is called a cone to abort the process. Where cancer has developed, treatment will involve radiotherapy and chemotherapy and possibly major surgery. In an aggressive move to reduce local cervical cancer cases, the government of Jamaica has taken a decision to introduce human papilloma virus HPV vaccines to protect against high-risk strains of this family of viruses. HPV vaccines are recommended for preteen girls and boys ages 11 to 12, providing immune protection from the virus before exposure.
We have 2 types. We have one that they call bivalent. It vaccinates against 2 types of HPV, 16 and 18, because HPV are numbered. And there is one that is quadrivalent that vaccinates against 6, 11, 16, and 18. 6 and 11 vaccinate against genital warts, while 16 and 18 vaccinate against 70% of cervical cancer.
There is a new vaccine yet to be introduced that vaccinates against 9 types of HPVs. This has the potential to prevent up to 90% of cervical cancers.
We are going to do better when we have the cervical cancer HPV vaccines.
Take the necessary actions to stay healthy. Get screened yearly, eat well, exercise, and get vaccinated.